Is it safe for our kids to go back to school? That, of course, is the million-dollar question. And joining us now with answers is Dr. Kohli. Hey, doctor. So a lot of parents definitely are waiting to hear what you have to say. But first, we want to ask about the FDA's emergency announcement just yesterday. Blood plasma is now allowed as a treatment for COVID-19 patients. The president claims this is a proven to reduce mortality by 35%. What do you make of this?
So Sam, convalescent plasma has now been studied in greater than 70,000 patients. And the good news is that it's quite safe. But I'll be honest, I was very surprised with this emergency use authorization by the FDA because the data for its efficacy is actually quite weak. Now, in the clinical trials, some patients that got convalescent plasma did get better, but there was no control arm. So you don't know if they didn't get plasma, whether they would have gotten better anyhow. And that 35% that the president is talking about is a relative risk reduction comparing plasma given early to plasma given late, or a higher dose of antibodies in the plasma to a lower dose of antibodies in the plasma. So it's not talking about whether the plasma works compared to no treatment at all. So I think there's still a lot of outstanding questions. And to be honest, I was very surprised with this EUA coming based off of the evidence that we know.
All right, Doc. Now, a lot of parents want to know this regarding schools. I'm sure you're interested in this as well because you have a young nephew. What advice are you giving to your brother about sending your nephew back to school? That's his son, your nephew, so you've got a stake in this.
So, Al, we've had so many conversations, my brother and I. It's the only time he actually calls me, believe it or not. And we've had a lot of back and forth because it is such a difficult time to be a parent and such a difficult decision to make. So we've talked about four main factors to really help you decide. The first is, what are the cases doing in the community? The second is there anyone high risk at home that the child could bring back the infection to? The third is, are there extenuating circumstances like childcare issues or lack of access to internet or other such issues that would sway your decision? And then the fourth is, what are the schools doing in terms of precautions, and do you feel comfortable? So we've had a lot of conversations, and my nephew has gone back to school, but I'm really curious to hear yours and Sam's perspective, because you're both parents and you both have kids going to school, or in Sam's case, Sophie's going to pre-K. So how do you guys feel about what's going on?
I'm so torn, Al. I just pulled Dr. Kohli. First of all, thank you for defining what nephew means, Al.
I knew that was coming. I knew that was coming.
Okay, I won't even go down that rabbit hole. But no, Dr. Kohli, it literally took me all summer long to finally come up with a conclusion, and I decided to keep Sophie home. We are going to, oh, there she is, homeschool her. I mean, I'm not sure what they really learn in pre-K, but we'll find out and we'll apply it. Al, what are you doing? Your kids are older, so it's a lot more important what you're doing.
They're at home.
Yeah.
They're at home. I mean, it's tough. It's difficult. I think every parent is going through the exact same thing. It's hard to work when you have kids at home, especially when they're of a certain age, and also keep an eye on them. So it's tough. We decided to keep them home. I'm still down, and Dr. Kohli, maybe we can talk about this the next time. What about having school outside while it's still warm enough?
That is a great idea.
That's a fabulous idea, Al, because we know the transmission outside is 19 times lower than inside. But I have to say, you guys, that I'm very supportive of your decisions, because if I had a child, I would probably lean that way as well. And we worry so much about them not socializing or getting the right development. But I really want to reassure the parents out there, no matter what decision you make this year, it's going to be okay. Your child will bounce back. And that's the great thing about kids. They're so versatile.
Thank you for saying that, because I know that a lot of parents out there are feeling guilty,
That's
no matter
right.
which way they decide to choose for their kids. We appreciate you, Auntie Dr. Kohli, because you have a nephew, your brother's son. Thank you, Doctor. You'll be back next week. So if you have a question about coronavirus you want answered by Dr. Kohli, write us on social media. You can also email info@dailyblastlive.com.